All right. So, welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rori Alter, clinical coach here at Progressive Rehab and Strength, with my lovely co host, as usual, Dr. Alyssa Haveson and Dr. John Petrizzo, who are both clinical coaches here at Progressive Rehab and Strength. And we have a very important episode for you guys today. This is going to be all about the Valsalva Maneuver. So, if you're new here, Dr. John is not only a clinical coach here at Progressive Rehab and Strength, but also a physical therapist at a local clinic, as well as a professor in exercise science at Adelphi University. He has published multiple papers in peer-reviewed journals, and he is very knowledgeable about all things exercise science, human body, physical therapy, etc., as well as strength training. So, we are going to talk about the Valsalva maneuver today because it is a very important piece of strength training, barbell training, and life. And I have a saying that I like to use, that the Valsalva maneuver, which is the breathing mechanism that we use when we are performing a heavy movement of any type against an external load. And it's something that we do automatically. And my saying that I like to use is that the Valsalva maneuver is NASA, necessary, automatic, safe, and adaptable. So, a common misconception about the Valsalva maneuver is that you shouldn't hold your breath, or you shouldn't utilize the Valsalva maneuver when you're doing something heavy or exercising with heavy load, because it's dangerous for your brain, your heart. You can have an aneurysm or a stroke, especially in the older population or the ill or sick population as well. So, John, why don't you share with us exactly what the Valsalva is, the mechanism by which the Valsalva maneuver occurs, and then we can kind of dive into the safety and effectiveness of it and why it's necessary, automatic, safe, and adaptable.
Sure. Um, and first thing I'll say is that I totally agree with you. When you hear the word maneuver, right, you think that it's like something
You do.
special that you're
Right.
doing, right, that you have to like make yourself do. When in reality, I look at it like a reflex. It's
Hmm.
something that even if you're trying not to do it, you're still going to do it to some extent whenever you're exerting yourself, like you said.
That's the automatic component of
Right,
NASA.
exactly. So the Valsalva maneuver is actually something. I mean, certainly we associate it with resistance training because this is the world that we deal with, right? But it's something that's been around really for hundreds of years. Valsalva was an Italian physician who originally created this technique because he thought that by basically holding your breath and increasing intracranial pressure that you were going to be able to dislodge um, fluids essentially and different sorts of substances from inside the skull through the ear canal. So his hypothesis was incorrect, but that's where it came from. And over time, it's been used in a variety of different medical procedures, right? And it's something that's been done um, medically for a variety of things for a long time. But like you said, anytime we're exerting ourselves, we are going to utilize this strategy as a way to help us um, make our force production more efficient. We'll talk all about that as we go. But um, classically, when you look at the Valsalva maneuver, it's thought to occur in 4 different phases. Um, and the important thing to stress here when we're talking about the difference between um, how it may be used in medicine versus how we use it from a resistance training standpoint. The second phase of the Valsalva maneuver classically lasts from 50 to 20 seconds of continuous strain, essentially, right? Um, and what we see when we are holding our breath for that long a period of time while we're trying to exert force is that in phase 4 of the classic Valsalva maneuver, we get an overshoot of blood pressure during the recovery phase, right? So we get this really high spike in blood pressure, and that tends to be what everybody cites, from an exercise standpoint as to why we need to avoid this, right? They say you shouldn't hold your breath when you're exercising. It's going to increase your blood pressure, and increasing your blood pressure is dangerous, right? Well, in reality, when we're talking about lifting, we're talking about holding your breath during the exertional portion of your repetitions, right? And even the heaviest, hardest repetitions that you're going to do, they may feel like they take 20 seconds, but in reality, they only take a few seconds to do, right? So we're never really getting to that point where we're holding our breath for a prolonged period of time where we would even expect to see that phase 4 high spike in blood pressure that we would traditionally see with the Valsalva maneuver, the way it's used in a lot of the literature on it. Okay, the way that we teach the Valsalva maneuver, and the way that a lot of strength coaches teach the Valsalva maneuver, is before your rep, you take a big breath, you hold it during your rep, and then in between your reps, you're breathing, right? So in reality, you're only holding your breath for a handful of seconds. Even under the greatest amount of strain. So when you think of
I just want to clarify. I just want to kind of reiterate the way in which the Valsalva maneuver, or a component of the Valsalva maneuver, is performed in barbell training. So like you said, it's you take a big you take the breath in before you do the rep, hold it while you're doing the rep, and then exhale between the reps. But I want to be like a little bit more specific, because I think that a lot of people still don't understand that concept. So what you do is you take a bit before you start any rep, you take a big breath in and you shut your mouth. You then execute the rep, come to a complete stop at the finish of the movement, exhale, and then you take another big breath in before you start the next rep. And I think that's kind of where a lot of people, there's many different areas where people get confused about the Valsalva maneuver, but that's one element that people get confused about, is then they start to confuse where they take their breath in, where they exhale. So it's the breathing in and the breathing out happen when you're not moving, and they happen between reps. Okay, you can go on now.
Yeah, no, I think that that's an important thing to stress, is that we're not telling you have to hold your breath for your whole set, right? We don't want you to hold your breath for a prolonged period of time. We just want you to hold your breath during the portion of the repetition where you're exerting yourself, where you're moving, right? Essentially, right? When you're not moving in between the reps is where you're going to breathe. So that in and of itself, should mitigate a significant portion of the concern that people have about the Valsalva maneuver. We're not talking about prolonged breath holding by any stretch of the imagination. Um, but still, and I deal with this all the time with my students, because I teach in an exercise science program, and what do all of the exercise organizations say? Don't hold your breath while you're resistance training, right? The American College of Sports Medicine, we can go on and on. I teach a course that's a preparation course for the CSCS exam, which is given by the National Strength and Conditioning Association. So you would think the National Strength and Conditioning Association, right? They're very pro resistance training, right? They're going to talk about the structural exercises like squats and deadlifts and cleans and things like that to a much greater degree than maybe the American College of Sports Medicine, which is much more kind of like general population, health and fitness based rather than performance.
Even though
And
they
even
still get the mechanics of the movements wrong.
Yeah, I mean, there's a lot of problems with their material, but they still, when they talk about breathing, they say instruct athletes to exhale through the sticking point, inhale during the less stressful phase of the repetition. Then, on the flip side, they also say for experienced and well resistance trained athletes performing structural exercises that you can use the Valsalva maneuver. So they kind of like, right, it doesn't make sense, right? Anybody that is like critically analyzing their materials just say, wait, on the one hand, you're saying don't hold your breath, it's dangerous. But if you're experienced when you're actually lifting heavy weights, well, then start doing it, right? Which really, if we're concerned again about safety and like you talked about previously, adaptability, um, it doesn't make a lot of sense. Why would we want to start using this thing that supposedly is potentially dangerous once we're already lifting very heavy weights? Why not start the very first time you lift, learn how to use it, and then adapt to that stress over time? Kind of like you mentioned previously. I don't want to kind of get ahead of myself too much here. But in
I know
regards to
I have so many questions that I'm writing down that I want to like touch on, such as like, what about people who get dizzy when they lift, and what about that
okay,
so hold on, and what about that uncontrollable sound that people make as they come out of a heavy lift, or like let's say a tennis player when they're hitting
hmm
something, like,
yeah.
so we can dive into all of that stuff, but what were you gonna say?
So I just wanted to kind of bring it back to this concern about increased blood pressure, right?
Mm-hmm.
And the first thing I'll say is anytime we are exercising, whether you're doing aerobic exercise or resistance training, any sort of exercise, your blood pressure is going to increase, right? Um, so we can't stop that from happening physiologically. If it were not to happen, it would be physiologically abnormal. Now, certainly when we're resistance training and working against heavier loads, we would expect to see a greater increase in blood pressure, right? But this thought that this increased blood pressure that we're going to see when we're resistance training is dangerous. So then we have to think about, well, what is it? What is the danger, right? What is the concern with increasing your blood pressure? Well, then really the only thing that I can think of that is a serious would be a serious concern would be causing a stroke, right? A hemorrhagic type of stroke, where essentially you are causing like intracranial bleeding to occur from that increased pressure, causing one of the vessels to burst essentially, right? And you mentioned aneurysm before. So what an aneurysm is a weakening in the wall of a blood vessel, right? That causes it to bulge. Um, and there's a percentage of the population that have aneurysms. So it's estimated between like 1% and 5% of people are walking around that have aneurysms, and don't even know it, right? Because there's no symptoms or anything like that, so they wouldn't even know it.
So
So,
I wanna touch on strokes,
mhm,
because I think this is kind of where the whole safety thing comes in,
right,
where people are very concerned about strokes. Most strokes are ischemic
right,
and versus a bleed.
hmm
So let's talk about the difference between, and the research shows us that first of all, strokes from exercise are not very common, and especially strokes in resistance training are not like, maybe like 1% of the resistance training population has
Oh,
them.
I would say it's far less than that. It's so statistically insignificant that you to put any sort of number on it would be an exaggeration, I think.
Right. And they're not like, the person who's at risk for a stroke is much more at risk for an ischemic stroke versus a bleed stroke, and one related to an aneurysm. So, can you talk about the difference and how
Sure.
the ischemic stroke is not actually even related to holding your breath?
First thing I'll say, a hemorrhagic stroke only comprises about 15 to 20% of all strokes in total, right? So the
All
majority,
strokes in total, ones
so
that,
so
yeah.
right. So the majority, we're talking about like 80 to 85% of strokes are ischemic in nature, and ischemic strokes are essentially it's the same mechanism that causes a heart attack, right? So it's a blockage in the vessel. So you
Mm-hmm.
have plaques that build up in the vessel. Plaque breaks off and causes a blockage, and then that part of the brain, in this case, if we're talking about a stroke, versus part of the heart, if we're talking about a heart attack, right? Essentially, the part that is supplied by that vessel gets cut off, and that causes damage to those tissues because they're no longer being perfused, right? So that's what an ischemic stroke is. It's the same mechanism as a heart attack, right? A heart attack is
And
a
that
blockage in the
blockage
coronary arteries.
and that blockage has nothing to do with holding your breath.
Right. No, no, that's something that builds up over the course of years,
Right.
for a variety of reasons. It could be, certainly genetics plays a role,
Diet
lifestyle
related. Yep,
factors, right? If
exactly.
you're a smoker, if you're,
Yep.
so there's so
Yep.
many factors that go into it.
Mhm.
Um, if we're talking about hemorrhagic strokes, now the most common mechanism for those um, to take place is prolonged uncontrolled hypertension. So we're not talking about an acute spike in blood pressure like we see with resistance training. We're talking about somebody that has high blood pressure that is not be having it treated, right? So they're not on medication, they're not modifying their lifestyle to mitigate it. So they have uncontrolled hypertension for a long period of time, and that constant increased pressure that's being exerted against the vessels over a long period of time leads to them to have a bleed, essentially, right? Um, so there's a big difference between someone that's had hypertension for 20 years that now has a stroke versus someone who's resistance training. And what the data says in regards to resistance training is that resistance training in and of itself can have a positive impact on your resting blood pressure. So it can actually lower it a little bit, certainly not as much as cardiovascular exercise, but it does have a positive impact on your resting blood pressure, which should in turn then have a positive impact on, the
Decreasing
likelihood of
your
you having
risk.
a hemorrhagic stroke.
So, can we talk about why blood pressure increases during exercise and resistance training outside of the Valsalva maneuver? What is that protective mechanism of increased blood pressure when you're producing force against an external load?
Well, I mean, certainly uh, when we're exercising, whether we're talking about cardiovascular exercise or resistance training, there's increased demand on the heart to supply blood to the working muscles, right? At the same time, those working muscles are exerting pressure against the vessel walls, so the heart has to work harder to pump the blood through the vessels, and that's where we get those numbers from. So when we're talking about blood pressure, for anybody that's maybe not aware, right? You have two numbers. The top number, the systolic number, is the measurement of the pressure that's inside the vessels while the heart is contracting. So that's always going to be the higher of the two because there's going to be more pressure exerted against the vessel wall when the heart's contracting and trying to force the blood through. And then the bottom number, the diastolic number, represents the pressure in the vessel when the heart is relaxing. So
Mhm.
typically we see an greater increase in the systolic blood pressure during exercise and really, maybe a slight increase to, you know, um, minimal increase in diastolic. It shouldn't be that significant. Okay. Um, so that's really what blood pressure is representing. So when you think about the body, right, the fact that the heart has to pump blood to all the working muscles, and at the same time the muscles are exerting pressure against the vessels, that's where we get that increase in blood pressure from. Now, when we're resistance training, certainly that pressure is going to be higher, right, versus some sort of cardiovascular training. But again, it's going to be higher for brief periods of time, right? So cardiovascular training, it's more of this kind of continuous modality of exercise, whereas resistance training, we're talking about, brief periods of really high exertion followed by periods of rest and recovery, right? So really, it's a different type of response that we would expect to see.
So, now what are people worried about in terms of intracranial pressure?
Well, so the thought is really, and this ignores a lot of the physiology, is just that, well, if you if you're holding your breath, when we know that blood pressure increases when we exercise, if you hold your breath, it's going to increase even further, and further increasing your blood pressure is just going to obviously it's going to obviously increase your risk for, causing a stroke, essentially, right? For causing damage to these vessels. Now, the the reason why And the first thing I'll say is that there really isn't a lot of data on any of this stuff, right? It's not something that's been heavily studied. It's not like there are these longitudinal, randomized controlled trials where they're taking intracranial pressures of people while they're lifting using Valsalva versus not and things like that. The research, there is some research on it. And the research is, I think, fairly conclusive, saying that the Valsalva maneuver is one, unavoidable, and two, safe and even protective. And then, any sort of research that says, oh, the Valsalva maneuver is dangerous, tends to be like these case reports or case
Mhm.
studies of someone
Mhm.
that happened to have a stroke while they were exercising, where there's no way of telling whether or not they were really using the Valsalva maneuver to any significant degree. It's just the kind of thing, these people happened to be exercising while they had a
Mhm.
stroke, and therefore the association is, well, it must have been the Valsalva maneuver that caused it, and blah 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 blah, right? Um, so so when we're talking about Valsalva maneuver and we're talking about holding your breath while you're exerting yourself, so obviously, like we just said, anytime we're exercising, and certainly when we're resistance training, there's always going to be an increase in pressure inside the vessel, right? That is what the systolic number in our blood pressure represents, right? Now, what's happening, um, at the same time when we are using the Valsalva, is that we are increasing the pressure outside of the vessel, right? So we have this increased pressure from the blood being pushed against the vessel wall inside. And at the same time, we are applying a pressure external to the vessel. So in reality, when we are using the Valsalva maneuver, we should be decreasing the pressure gradient between the environment inside the vessel and the environment outside the vessel. Now, if we're talking about the brain specifically, right, and if we're talking about the concern for
Well, can you
hemorrhagic
can you
stroke,
talk about what the importance of decreasing that gradient is?
well, I mean, if we're concerned about hemorrhagic stroke, which again we've said it's a very rare thing to happen during exercise anyway, um, if we have a greater difference between the
Mhm.
pressure inside the vessel and outside the vessel, that would seem to be a good way to create the thing that you're trying to mitigate, right? By
Mhm.
having really high pressure inside the vessel, but exhaling to try and decrease the pressure outside of the vessel, right? Um, so if we're talking about the brain specifically, right, the brain floats in cerebrospinal fluid. The spinal cord is has cerebrospinal fluid surrounding it. So we have this increase in pressure inside the vessels, and that's throughout the body. That gets transmitted certainly uh, into the vessels in the brain. When we perform the Valsalva maneuver, right, and we get this hard isometric contraction of all the trunk musculature, that pressure then is applied to the spinal cord, and that cerebrospinal fluid, that pressure is applied then also to the cerebrospinal fluid around the brain. And again, we are decreasing that pressure gradient essentially from what's inside the vessels to the environment outside of the vessels. So in reality, the Valsalva maneuver is actually safer from a physiologic standpoint if we are concerned about creating a hemorrhagic stroke.
Mhm.
And the research, I think, supports that. Like I said, there's not a ton of it, but the research that has been done has shown that there is less of a gradient between the internal environment and external environment, um, which theoretically should be safer, right? Um, so I think when you actually take the time to analyze it physiologically, and not just make this simple kind of assumption that increased blood pressure is always bad, um, we can make the case that the Valsalva maneuver is safe even for someone that has an aneurysm, right? And like we said before, there's a percentage of the population that's walking around that has these things, right? That most likely don't know it, that don't have any symptoms. More than likely, there's some of those people that are engaging in resistance training on a regular basis. More than likely, whether they're trying to or not, they're probably utilizing the Valsalva maneuver to some degree. And yet we don't see really any significant incidents of these types of cerebrovascular accidents occurring. in the resistance training population, right? I mean, all three of us, Alyssa, myself and you, we've been involved in powerlifting, right? We've been at lots and lots of powerlifting meets, and not everybody who's
I've
at a
never seen a
powerlifting
stroke
meet,
at a powerlifting
right?
competition.
Not everybody at a powerlifting meet is a health nut, by the way. You know what I mean?
Yeah.
It's not, so it's not like these are people that are in peak physical condition all the time. These are really, really strong people who have gotten very specialized at these three lifts. Some people are obviously very fit and all around great shape, but I'm saying that's not always the case, right?
Hmm.
And those are people that are lifting maximum weights, right? The heaviest weights that they could possibly lift, and you still don't see it even in that population. You don't see, it's just something
You'll
that
see their quad tendon fail before their blood vessels
I mean,
fail.
yeah, from an empirical standpoint, and like the example I use with my students is like, if this is such a big concern, why don't we see it happening, right? Like theoretically, then people would be dropping left and right in the gym, at powerlifting competitions, at these sorts of events
Strongman
where,
competitions.
right, any of those things, and we just don't see it happening. So, put all the research aside, just use your reasoning, just use just use logic, and you'll see that really this is not something that is such a huge concern for from a safety standpoint. So it's more this thing that these exercise organizations, they're really doing, I think, practitioners a disservice
Hmm.
by trying to dissuade them from doing something that is natural and safe, and telling them you better tell your clients to exhale when they're exercising, when in reality there's essentially no risk to using it.
Alyssa looks like she has a question.
Well, I have a question, but you made a good point when you said most people are doing it anyway, whether they're trying to or not. And
Mhm.
I think,
I was gonna say the same thing.
you know, somebody who's not trying to do it is probably at some point straining and holding their breath as they're
One hundred
as they're
percent.
finishing a set
Yeah.
Yes.
or a rep. And then
Yep.
it's, well, now
Even
we're
on
in
the
a
machines, it doesn't matter if we're talking about
yep.
squats or deadlifts, anything.
Hmm.
And then it's just not done in a way that is intentional and
Hmm.
purposeful and optimal.
Right.
Yeah, it's just,
So
and you're not
Yeah.
even like preparing for it or adapting it. So can we, Alyssa, I really like that you mentioned this because it's automatic. So,
Right.
and John, you use the word reflexive,
Yeah.
and just for my NASA acronym,
Uh-huh.
I like to use the term automatic. But like when I'm talking to people or trying to explain why it's safe and how they do it anyway, even when they don't realize that they're doing it, I try and bring it into like functional things in their life.
Yeah.
If you're moving a couch across a room, or
Mhm.
you're lifting it with someone, like chances are you're going to gear yourself up to lift up that heavy couch, and like there
100%.
your body just does this stuff automatically.
Right. Because
And yeah.
because anytime you have to transmit force, you want to stabilize your trunk, right?
Hmm.
And that is the way that we stabilize it. So, um, and not to cut you off, but it's just another thing that kind of popped into my head is, you know, any woman that has had a child via vaginal delivery has performed the Valsalva maneuver, and not all these women are resistance trained. They're not, you know what I mean? You're telling me that those aren't extremely high pressures? I mean, do we see women having hemorrhagic strokes while they're giving birth? I mean, it's just, again, it just is very tiresome to have to like go through this whole process of trying to convince people of this stuff when the information is like all around them.
Yeah. Yeah.
But I'm sorry, I didn't mean to cut you off.
No, it's okay. Go ahead,
so
Alyssa.
since people do have concerns, are there any
Mhm.
situations where you'd advise against using the Valsalva maneuver, and how do we screen for the people at higher risk of anything?
I mean, honestly, I do not think that there's really a situation that I can think of where I would not utilize the Valsalva maneuver. If I have people that are barbell training, certainly I am always going to make it part of the instruction. If I have people that are doing like machine-based resistance training, I generally just don't even talk about it one way or the other, because again, it's going to happen automatically to a
Hmm.
certain extent. I had a young girl that I worked with for about 5 years. She was a student at the university, and she had actually did suffer two hemorrhagic strokes as an adolescent. So she
Not because
had
of resistance training.
no, just a genetic,
Mhm.
just bad luck essentially, right? And she had a certain degree of hemiparesis, so one side of her body was not as functional. Um, and I had her resistance trained because she had problems with her upper extremities. She couldn't really grasp things to the degree that we would need to really barbell train. But she would leg press, she would do chest presses, she would do kind of multi joint machine based resistance exercise with me. And I know that there were periods of time while she was training where she was holding her breath while she was exerting herself. And I was not concerned about that, even in that instance, because what had caused her to have the strokes had been surgically corrected, right, and that sort of thing. Now, um, and I think if you look at the analysis, even using someone that has an aneurysm, now the majority of people, they have no idea that they even have them, right? But if you have this weakening in the vessel, wouldn't you want to
Strengthen
mitigate
it.
any sort of pressure gradient between the internal environment and external environment? So I would argue that it's even safer in that instance. So
Mhm.
I'm sure that there are some medical conditions that would probably preclude its use, but my guess is that those are people that are probably not coming to the gym looking to resistance train anyway, because they have
Yeah.
other health problems that would mitigate that. So um, in my professional career, I really have not come across anybody where I have been extremely hesitant to use the Valsalva maneuver, and I've been training people since 2006 at this point.
So I want to so just to two things to kind of touch on the teaching someone to breathe properly when they're lifting. So you said that you included in part of the instruction, but so one thing that I have kind of adapted into my own practice is a lot of people come when they're first learning a new lift, the barbell lifts can be quite confusing for them and they're focusing on so many things. So oftentimes because people do it naturally and automatically, I sometimes don't even teach it to them until later teach. And that's the funny thing is that we say teach, but
Mhm.
it's like oftentimes we're unteaching bad patterns from poor beliefs or wrong belief systems around breathing. When we have people who come from us that have like worked with therapists or coaches who are certified in PRI or this and that technique, and they're teaching you some weird breathing patterns when you lift, or people who push their bellies out into their belts and blah, 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 which is not the proper way to do the Valsalva maneuver. And they have all these problems that they're trying to fix, like incontinence or back pain or hip pain, or they keep tweaking like an intercostal or something like that. And they come to us because they're having issues. Then often that's like the only situation where I'll start with teaching someone. But oftentimes when it's so overwhelming to learn something new, that I don't even add the breathing until later, because we're not going to start someone with something so heavy that they need to balance that gradient. Um, so I tend to bring it on a little bit later, but this kind of ties into the next conversation, but also answers one more, kind of dives into Alyssa's question a little bit further. The only scenario where I've ever not used the traditional Valsalva maneuver where you're holding your breath the whole time is when someone is experiencing failure of their pelvic floor, or missed time, like they've had some type of like neurological disconnect with their pelvic floor and they're getting leaking while they're lifting. That's not related to load, it's not related to technique. And we've done all the technique stuff, we've done all the load management, and they're still having leaking. Sometimes during the exertional phase or the concentric portion, we'll have them exhale or make a sound like a hissing sound, and that can increase the contraction of the pelvic floor. But we're going to have a discussion with our pelvic health specialist, specifically on the pelvic floor and how that works when we're lifting. So we'll dive into that a little bit further. So when someone's leaking and we've kind of like done everything that we can from a traditional load management technique programming standpoint, then we might want to say, let's exhale while we're performing the concentric. But this kind of ties into, can you talk a little bit about increasing intra-abdominal pressure and why we're using the Valsalva maneuver for that purpose?
Sure. I mean, it's really kind of simple. I mean, um, when we perform the Valsalva maneuver, and the reason why I think it happens automatically is because by holding our breath, essentially what we are doing is increasing intra-abdominal pressure, right? So you take a breath in, your diaphragm descends into your abdominal cavity, decreasing the volume of the cavity, right? And you're holding your breath. You have the isometric contraction of all the trunk musculature. So we're talking about the layers of the abdominal muscles, the isometric contraction of the spinal muscles, the pelvic floor, right? All of these muscles are working isometrically. In conjunction with the diaphragm, what we get is an increase in intra-abdominal pressure. So if we're thinking about our spine when we're lifting, we know that we want to keep it as stable as we can, right? Obviously, we know there's no way to totally prevent, some movement of the spine when we're working against very heavy loads, but we want to keep it as stable as we can. From an efficiency standpoint, it helps us with force transfer. So we use that increased pressure and apply it to the spine, essentially, right? So we have the posterior spinal muscles working isometrically to kind of stabilize the spine from the posterior, but we use this pressure that's built up inside the abdominal cavity that gets applied to the spine anteriorly, right? So we're basically, it's helping us stabilize the spine from both the anterior and posterior side, is the way that I would, kind of look at that.
Yeah. So if you're new to the podcast, or you're not caught up on the podcast and you're just jumping to this episode, go back to our spine, functional anatomy of the spine with John, because he did talk about all of the elements of the posterior aspect of the spine, which cause or create stability in the spine. But then on the anterior side, we don't have as much musculature, we don't have as much ligamentous support, because, well, not because, but in response to that, or the way that we balance the support and the stability on the anterior side is through creating intra-abdominal pressure when we're moving against any type of external load. So our Valsalva maneuver is an extremely important component of creating stability for the anterior, or just creating stability in general for the spine. Now, in terms of, because this is something that I assess when I'm looking at someone performing the Valsalva maneuver correctly, or if they're coming to us with back pain, hip pain, or any type of pelvic floor issue, when we're looking at the abdomen to see if they're performing the Valsalva maneuver correctly. And this kind of also goes into busting some myths about pushing your belly out or bearing down or you pushing into your belt and all this kind of stuff. What does the abdominal musculature do to also help increase the intra-abdominal pressure when we are creating the Valsalva maneuver?
Well, like I said, I mean, if we're thinking about increasing pressure, right, we have to kind of decrease the volume of the cavity. So
Or the
if as the
space in the
diaphragm is
cavity, yeah.
descending, right, if the abdominal musculature is not isometrically, holding its position essentially, right, and we're expanding our bellies, like pushing out into the belt,
Mm-hmm.
well, then you're not really decreasing the volume of the cavity. You're not going to get that increase in pressure that you're looking for, right? Or
Mm-hmm.
at least to the same degree, So
Mm-hmm.
I never talk to people about pushing at their belly out into their belt. And I know you want to talk about belts kind of separately, so I won't even get into that now. But um, or just like pushing the belly out, or anything like that, because that's going to make your Valsalva maneuver less effective, right? So you want an isometric contraction of the abdominal musculature to basically stabilize your abdominal wall so it doesn't distend, right, to any significant degree, so that you're able to really increase the pressure to the greatest degree that you can. And the one thing I'll say in regards to this spinal stability stuff, what we have seen in the literature is that the more stable the spine is, the greater muscular recruitment we get in the extremities, right? So,
Hmm.
so it's not just a spinal thing; it's making your whole, lift, your whole movement pattern more efficient by making you better able to recruit. The more stable your spine is.
Yeah.
I think that that's an important consideration. And to talk about injuries a little bit, and I know it's like not the popular thing right now to say that lifting with a neutral spine is important for injury prevention, things like that, right? But so I'm not even going to get into that topic. But what we do know is that back injuries are very common throughout the entire population. We
Not
also
just the
know
lifting population,
not
the
just the lifting
entire
population,
population of the
but when we do
universe.
look at the data on lifting related injuries, back injuries tends to be the most common thing, which, like I said
Consistent with the
in the
rest of the
previous, right, is
population.
just
Yeah.
consistent with the rest of the population.
Right.
Um, but what I will say is that increasing the intra-abdominal pressure and trying to stabilize your spine to the greatest degree that you can, I think probably is something that would have a positive impact on injury risk reduction.
Absolutely. And we see this with our injured clients who have back pain, that one of the most common aha moments or epiphanies they have about their injury and continuing to train is that when they brace better, they have less back pain.
Hmm.
So the more stable we make our spine, the better it feels, especially when we're recovering from injury. And the more stable we make our spine, the less risk it has for injury.
Right. And that's not to say that you shouldn't be moving your spine and training different, throughout different ranges of motion and things like that, right? So there's a difference between doing something, specifically to like increase your tolerance to spinal flexion, right? Versus trying to keep your spine stable when you're doing a squat or a deadlift, and
Hmm.
I think that people get so caught up in this stuff. I don't think that there's really should be any significant argument that keeping your spine stable during a squat or a deadlift is a good thing from a performance standpoint. Um, and that's not to say that you shouldn't be moving your spine in a variety of directions and training it through different range of motions, but that's a different kind of goal, right?
Hmm.
Than when we're doing something like a squat or a deadlift.
Hmm. All right. We have a couple of questions that we wrote down. I mean, everything that you just talked about is completely in line with my NASA acronym: necessary, automatic, safe, and effective. Um, it's necessary to increase intra-abdominal pressure and stabilize your blood vessels, your blood pressure, and your spine when you're barbell training. It's automatic. We do it anyway. It's something that we do when we go to the bathroom, when we lift something heavy. I mean, we're watching our little baby grow up. He's 2.5. And like when he's doing something hard, he's holding his breath. Like these are things that we just do that we're never taught to do. And in terms of safety, it increases the safety of your spine, and it's safe to do because it's going to actually increase the safety of your brain, your blood vessels, and all that good stuff, and your spine. And then it's adaptable. We didn't really talk about adaptability of the Valsalva maneuver. So kind of, just in terms of the same thing that, we talked about an aneurysm being a weakening of the vessel wall, you know, um, and when we're barbell training or when we're doing any type of progressive overload and resistance training, every little bit that we lift more than the last time, every little bit of stress that we place on our muscles and our bones and our neurovascular system, like everything in our body causes an adaptive response to make it a little bit stronger. So every time we resistance train and perform the Valsalva maneuver, we're creating a stress recovery adaptation cycle in our vessels as well. And that is, I'd argue, even more important for people who are at risk for aneurysms or people who are, getting older. When we start to see aneurysms develop, the stronger your vessels are, the more protective it is as you age, and the more protective it is of aneurysms or hemorrhagic strokes even.
Yeah, I mean, I would agree. And, if we're talking about the adaptability of it, this is where I have an issue with the NSCA kind of trying to have it both ways, right? They're
Mhm.
trying to play the game of
Don't
all
do
the
it, but
other
then do it when
exercise
you need it.
organizations, like, don't do it, but when you're advanced, it's okay to
Right.
do it. And
But then
to
your
me,
Valsalva
that's
maneuver isn't advanced.
right. But it's so to me, that's not the way to go about this, right? If you're teaching somebody how to use it, it should be early on where they're really relative to the weights that they'll be lifting in 6
Mhm.
months or a
Mhm.
year, 2
Mhm.
years, down the road. The weights they're lifting are relatively light, right? They're not going to have the same pressure response squatting 150 pounds as they are 400 pounds, right? So you might as well get your body accustomed to the Valsalva maneuver at those lighter loads, and like you said, let it adapt over time to those higher pressures, right? Anybody that's squatting 500 pounds, that's not the first time they're using the Valsalva maneuver, and it shouldn't be, right? They
Right.
shouldn't. There's no magic number where all of a sudden you're like, well, now this is heavy. I should be using the Valsalva maneuver, and that's why I really disagree with the way the NSCA, words their position on it. It's something that, like we said, it's automatic. It's something that your body certainly can adapt to over time. And it should be implemented early on in your training, and just progress just the way that you progress in weight up on the bar. That drives adaptation, like you said, throughout the body, and being able to handle gradually increased pressures that you're working against is one of those adaptations.
Alyssa, do you have any questions?
I do. So we haven't really talked about people who are getting dizzy when they lift.
Hmm.
And um I'm wondering what your recommendations are for that and what you suggest and if the Valsalva maneuver affects that at all.
Yeah, so this is one thing I'll say, and because this is a question I get from my students a lot when I talk about the Valsalva maneuver, they're like, "Well, what about people that pass out when they lift and stuff like that?" I mean, again, in my opinion, it's something that you see more as a result of social media and YouTube and that sort of thing. I mean, like, I've been lifting in gyms for well over 20 now. I've been going to powerlifting meets for 10 years, 11 years, and I have never actually seen somebody like pass out like in person. You know what I mean? Like, it's just something that I don't think is super common. And I think, people's perception, because they see this stuff on YouTube and things like that, it's like these fail compilations and stuff. It's like this perception that that's a super common thing. Again, you walk into any gym, you don't see people just like falling over, passing out from doing squats or deadlifts like on a regular basis. But certainly it can happen, right? Um,
I don't
and
usually think that it's as a result of the Valsalva maneuver. It's more often a result of it's like a vagovasal response, when the load is so heavy in their hands that it's pulling down on their traps and their collarbone and it's compressing the neurovascular structures in their neck.
right,
I
I
you
mean,
know,
I think to kind of to further make that point, if you look at the front squat, right,
mhm, mhm,
that would be an exercise where people are certainly more prone to getting
mhm,
dizzy or
mhm,
passing out, and it would be that type of mechanism from that pressure being
mhm.
applied to those
I see that. I
structures.
do see it in the squat and the deadlift. So actually kind of to dive into this a little bit more, especially if you're a clinician or a coach trying to figure out why your client is getting dizzy when they're lifting, it's usually not the Valsalva maneuver. It could be an inner ear thing. So when we're seeing, especially on the deadlift, when we're seeing them go from the ground to standing erect, so going from this horizontal position to their standing lockout, they could be getting dizzy from an inner ear issue. And they also, like I said, I've seen it that the pull of the weight in their hand, and on their arm, and then on the neurovascular structures in their shoulder, can cause some dizziness and that weird feeling of wanting to pass out. So you have to figure that out. And then we can also see it in the squat where it's not a Valsalva issue. It's that because of the bar position, on their shoulders, and tightness pulling across the front of their neck and the front of their shoulder, and their bones kind of just pushing on the neurovascular structures in their neck region, that's when they can start to get dizzy, especially on higher rep sets in the squat. So I typically have not seen it because of the Valsalva maneuver. I've seen it more because of inner ear and kind of vasovagal issues.
And just one thing I'll add to that, I agree. When I have seen it, it has been really with deadlifts, and I think the change in head position, has a lot to do with it, and certainly, like I said, front squats. But I would agree. I don't think that it's really a Valsalva maneuver. I think that, like you said, it could be a vestibular issue. It could be a vasovagal response. And I think
like
the other thing,
orthostatic type
and
thing.
the other thing to keep in mind is that, when you're seeing these videos on like the internet of somebody passing out, like, you don't know, was that an all-time like 1 RM by like 50 pounds that they're trying to, you know what I mean?
Right,
So like
yeah.
we talked about the adaptability of it.
Mm-hmm.
And I think if you're making small, gradual increases over time, you are far less likely to have those sorts of things occur. So I think a lot of it is like a programming issue and giving your body time to adapt to those stresses in an incremental way. Whereas, I would think like you see these things at powerlifting meets, if you have somebody like pulling a third deadlift where they're trying to win the meet and they're just doing something that maybe their body just wasn't prepared to handle,
yeah.
then I think you could see some of that stuff, so I would also relate it back to that a little bit as well, in addition to the things that Rori
Speaking
mentioned.
of competitions, we hear a lot of sounds at competitions. So I think Alyssa has another question.
Yeah. So, and I was going to say about like when we see people fainting, we also have to consider
Their
everything
nutrition,
outside of training. Yeah. So,
hydration,
Yeah,
all of that
nutrition
other stuff.
status, right?
Yeah.
The same thing like when you see people like vomiting at a meet, like
Yeah.
it's like
Yeah.
that is probably a mistake in terms of their nutrition and timing and things like that, as much as it's anything else.
So when it comes to like holding our breath and Valsalva maneuver, what about that uncontrollable sound that we hear that lifters can make, and like kind of tennis players make when they hold their breath?
So I think that really
or even
comes
like
from,
pitchers when
yeah.
they pitch.
yeah, I mean, in martial arts, right? I mean, it's just
Mhm.
kind of this universal thing, and I think that stems just from a little bit of air being pushed through the closed glottis, essentially. I don't know that as a fact, but that would be my assumption. So certainly, like, a tennis player, a martial artist, a pitcher, they're exerting themselves, but they're probably not actively trying to hold their breath to the degree that like a lifter is, right? When they're doing a squat or a deadlift, that they've been taught to do it, right? They probably fall into the category of people that are utilizing the Valsalva more as an automatic thing, in response to the activity that they're participating in. And as such, I think that some of that air is getting through the closed glottis, and that's where that sound comes from.
Yeah, and I think when we're lifting, that sound kind of comes after the hardest part of the lift. It's not, try and let your air out when you're at the sticking point and you're going to fail,
Yeah.
So I think,
Yeah,
if
I would agree. Like on the squat, it's like the top third of the
it's the
movement where
yeah,
that'll
it's like
happen.
as you're like, okay, I'm safe, like I made it through, and then you like start exhaling. And I would say that it is it like the just asking the two of you, have you ever like intentionally made that sound when you finished a lift? It just kind
No.
of, the heavier the lifts get as you start to warm up until you get to your working sets, like that kind of increases with your effort, because the amount of air that you have to take in and the amount of pressure that you're creating inside your abdomen. When you exhale, the air comes out with that much pressure, so you'll see the sound get louder and louder, for those people who do make sounds. But I think most people make sounds when they're doing near max effort lifts, or as they need to recruit more intra-abdominal pressure. The more pressure that you have inside, when you release that air, it's just going to make more noise. it's going to be louder. So I think this was a really, really great talk on the Valsalva maneuver, John. Thank you so, so much. I think that we busted a lot of myths and misconceptions and poor belief systems around the Valsalva maneuver. We talk about it all the time with our clients. I've made a couple posts on Instagram about it, and it's always like every time I post about the Valsalva maneuver, it's always like a mega hit on Instagram. And I know that this is just such a hot topic, a very controversial topic. We see it taught so differently. And we're going to have a 10-minute tip that comes out right after this about belts, bracing belts in your back. And there's so many misconceptions about bracing belts in your back that kind of tie into the Valsalva maneuver. So we're going to continue this conversation in our next 10-minute tip. So for those of you who are really interested in this or struggling with back pain or incontinence or hip pain, or even just struggling on progressing your lifts, because like you said, John, the more intra-abdominal pressure and stability we have in the spine, the greater muscle recruitment or motor neuron recruitment, motor unit recruitment we can get in the extremities to produce force against the external load. So if you're struggling with progressing your lifts, maybe the Valsalva maneuver and proper belt use is the missing link if your technique and your program are really good and solid. And so, the kind of misconception that a belt is a crutch or a belt makes your core weaker, we'll bust that in the next 10-minute tip. So thank you, John, for joining us. Alyssa, as always, love having you both on the podcast. John, you're becoming a co-host here on the podcast too. So we'll see you all next time. And thanks again. Bye for now, guys.